someone tells me that they're pregnant, I immediately want to ask them if they've seen the guidance counselor. It's difficult for me to remember that I'm at an age where having a baby is a blessed event instead of an after-school special. So, when a doctor said to me,
"So, I hear you want to have a baby."
"What? No!"
"Oh, well then how come you found your way into an IVF facility?"
"Oh, I mean, I do want to have a baby, just, a very, very long time from now, not today."
Of course, but the reason you're seeing me today is because you have breast cancer, correct?
I do, and I need to start chemotherapy in 2 weeks.
Okay, well that doesn't give us a lot of time. We're going to have to start doing a series of tests to determine...
Now, I know that Dr. Endo said a lot of things about cycles and ovulation and whatever, but honest to God, I don't remember any of it. All I could think about was Dr. Endo. I mean, look at him. I bet a lot of ladies who weren't sure about getting pregnant were inspired just looking at that guy. Would it be weird if I kissed him?
Hello?
I'm sorry! I swear, they pump these clinics full of pheromones. But seriously, who wouldn't want that guy to knock them up?
What?
So, first we'll do an intravaginal ultrasound, and we'll just figure things out from there.
So what if my cycle doesn't line up, then what?
Then we treat your cancer. Well, I'm not an oncologist, so I don't want to speculate, but you should be able to have babies on your own after chemotherapy. This would just be a good insurance policy. Now, this is Susan. She's going to take some blood and get you prepped for the exam.
Okay.
Oh, you have breast cancer, huh?
I do.
Yeah, we see more and more young women coming in with that all the time. My sister had it. So, what do you do?
I'm an actress.
Really? I thought about that. I was a lead in all my high school plays.
Oh?
Yeah, used to tell me I had a voice like Barbara Streisand.
I'll bet.
Okay, we are done here. Follow me to the exam room.
Back in the exam room, Dr. Endo performed an intravaginal ultrasound, which is pretty much what it sounds like. Probing your vagina and seeing what's going on behind your ovaries. Back in the conference room, Dr. Endo broke everything down.
So, everything looks good. We'll be able to start stimulating you on Tuesday.
Stimulating me?
Yeah. You'll start taking follicle-stimulating hormones to facilitate egg growth. Right now you have 8 follicles, which is a good number to start with.
Okay, what's a follicle?
Oh, the follicle is basically just the sac that encases immature eggs.
Okay.
Now, your hormone levels are a little abnormal, so that might make things a little bit slower to stimulate growth, but we're just going to have to start and see what happens. Now, we're obviously going to be in communication with your oncologist to make sure that we're making the best decisions for you.
Awesome.
Now, Bethany's going to demonstrate how to give yourself the injections.
Wait, I have to give these injections to myself?
Yeah.
Couldn't just come in here and have you stick me?
Well, unfortunately, no. The injections are required daily, and that would be a lot of trips just to see me.
It's okay, I don't mind.
Don't worry, we'll be seeing each other plenty. I mean, we're going to have to check your growth rate and do blood tests every 48 hours of the next 10 to 14 days, so we'll be seeing a lot of each other.
Great. Perfect. I mean, whatever.
Bethany.
Hi, nice to meet you.
Hi, nice to meet you too.
Alright, I'm just going to walk you through this procedure. Remove the Menopur and Gonalef from their packaging. Uncap each and wipe with a swab. Take a syringe, attach a mixing needle, and get 1 unit of saline from the vial. Inject the saline into the Menopur vial and swirl it gently. Don't shake. The number of vials may vary from day to day. Regardless, use the mixing needle to extract the fluid from the Menopur vial or vials and inject it into the Gonalef vial. Again, swirl it. Don't shake. Exactly. Then remove the mixing needle because you don't want to stick yourself with a needle this size. Attach the needle for injection, pinch an inch, and inject the medicine.
Pinch an inch?
Yeah, just pinch an inch of fat, like from the stomach. Grab it, hold the needle at an angle, and inject the medicine.
Okay, I don't think that this is something I can do for myself.
Well, some people like to have other people do it for them.
People who need people are the luckiest people in the world.
Wow. So, now all I had to do was find people who loved me enough to jab me in the stomach with a needle.
I got this.